name is Bree. I'm with PARC Urology. Of course, you know Dr. Warren Snodgrass and Dr. Nicol Bush, but figured I'd introduce myself as well. Each week, you get to look forward to a video from me talking about post-operative and pre-operative care for surgery, just little things to expect, tips and tricks, as well as pretty frequent questions I get via email. So we might as well just dive right in. So I'll start with the first pretty frequent question that I get is what to expect after surgery. A lot of parents aren't sure if they can feed after surgery, when to give pain medication, things like that. And I'm here to tell you that you can go ahead and feed your little kiddo right after surgery. As soon as he wakes up, once he's up and moving and awake from the anesthesia, you can go ahead and feed him. That's whether he's breastfed, formula, crackers, things like that is totally fine. And then additionally, right after surgery, 3 hours afterwards, you'll go ahead and start the pain medication. It's possible you might still be at the surgery center or the facility that you had surgery at, or you could be back home in your hotel, depending on how long we had you stick around for observation. But 3 hours after, you'll go ahead and give either that Hyset that we gave, depending on his age, or just Tylenol and Motrin. So you have no worries. After surgery is we try to make it as painless as possible, make it super smooth for you as well as your little kiddo. So no need to worry in that regard.